Good morning, and welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesdays. My name is Courtney Howe, and today we are talking with Dr. Crystal Woods about mental health. The last 10 minutes of today's conversation are reserved for questions, so please leave your questions in the Q&A box if you're watching via Zoom or in the comment box on Facebook. Now, I would like to introduce Eric Davis, Vice President of Basic Needs, Health and Outreach, to tell us a little bit more about Dr. Woods and today's town hall. Eric?
Thank you, and good morning, Courtney. Good morning to all of you joining us today. So October 10th is World Mental Health Day. And so this week is a great time to highlight the importance of mental health to our overall health and well-being, especially in the stressful times we've been currently living in. Whether you're a parent or caregiver, a student, a frontline worker, a teacher, or a nonprofit worker, or some combination of those, we're all dealing with enormous levels of stress and uncertainty and anxiety. That's why we're thrilled to have Dr. Crystal Woods here with us to talk about the importance of prioritizing self-care and mental health as the COVID-19 pandemic continues. Dr. Woods is a clinical psychologist and a researcher. She received her BA in psychology from Yale University and her PhD in clinical psychology from Michigan State University. She currently works as the head of integrated behavioral health services at the Wellness Plan Medical Centers in Metro Detroit. Dr. Woods conducts individual therapy with adults, specializing in goal setting and behavior change to address the systems threatening to maintain anxiety and depression and to help clients create the life they want to live. She's also the author of several articles and book chapters on the impact of culture and gender on African-American mental health, psychological outcomes of racial and sexual harassment, and mental health help seeking. Dr. Woods, thank you so much for joining us today.
So happy to be here. Thank you for the introduction. So let me share my screen. Okay. So good morning, and thank you all so much for joining us today. As you said, my name is Dr. Woods. I'm a clinical psychologist, and I am the head of integrated behavioral health at the Wellness Plan Medical Center. So at the Wellness Plan, we have 5 clinics in the Metro Detroit area that specialize in primary care services. They also offer OBGYN, pediatric, dentistry, pharmacy, and of course, behavioral health services. So the Wellness Plan is a federally qualified health center, which means its mission is to serve the uninsured and the underinsured. So this morning, I am happy to take a moment from my regularly scheduled programming at the Wellness Plan to discuss the whys and the how-tos of prioritizing self-care in this time we find ourselves in the time of COVID. So with a virus that is spread across the globe, coupled with breaking news accessible to us at any time, it has made many of us worried, and it can be hard to stay calm when there is fear and unease in the media, stories of experiences with COVID-19, and all these changing rules and procedures at work and school. So a lot of people are feeling anxious, even if maybe before they rarely experienced anxiety. The COVID-19 pandemic has brought with it huge changes to our daily home and work life, personal illness for some people, and loss for a lot of us. So whether it be friends or family members, or worrying about catching an infectious disease while taking care of yourself and your family, this has found to be a stressful time. And so these assumptions about stress and COVID-19 are also backed by data. So in late February of this year, the American Psychological Association surveyed a diverse sample of over 3,000 adults. And they found that almost half of all parents are more stressed than they were before the pandemic, with stress levels being especially elevated for those who actually have children who are still doing at-home learning. And 67% of Americans said they're sleeping more or less than they want to since the pandemic started. 61% of adults reported experiencing weight changes at the start of the pandemic. So with adults reporting gaining an average of 29 pounds during this time. And nearly 1 in 4 adults report drinking more alcohol to cope with their stress during the pandemic, with essential workers being twice as likely to have been diagnosed with a mental health disorder. And over 30% of all adults under 75 reported that their mental health has worsened since the pandemic. With over half of all Black Americans surveyed in February said they felt uneasy about the prospect of adjusting to in-person interaction once the pandemic ends. And so this survey was done in February, as many of us right now are kind of toggling between this hybrid experience of starting to return to the office, but things being far from business as usual in the other areas of our life. Stress is often the result. So at the beginning of the pandemic, many of us were experiencing what we call acute stress. Acute stress usually occurs in response to a short-term stressor, like a car accident, or like if you encountered a bear when you were walking through the woods. So if you saw that bear, you'd find that your heart would start racing, your breathing might become more shallow, you might even start to feel a little dizzy or lightheaded. So in that case of acute stress, your sympathetic nervous system kind of functions like a gas pedal in a car to trigger the fight or flight response. It provides your body with a burst of energy so that it can respond to perceived dangers. So those physical changes, like your heart racing, your breathing changing, they're actually preparing your body to stand and to fight if you need to, or to run away as quickly as possible. Our heart beats faster to pump more blood to our large muscle groups in our arms and our legs. And our breathing becomes more shallow to get oxygen to those same large muscle groups that would allow us to fight or flee. We may even feel dizzy because a portion of that blood and oxygen that normally circulates throughout our entire body and brain is actually being diverted from our brains to our body to prepare it for action. So in this situation, our nervous system wants us to use our physical power, not our instincts and not our complicated brains, to survive the moment. So acute stress can be distressing, but it passes quickly. So at the start of the pandemic, we were experiencing acute stress. We were facing abrupt changes at work, school, and in our social lives. And we may have even been operating under the assumption that, oh, this will soon pass, and we would get back to our normal lives. However, now we find ourselves 1.5 years into the pandemic that's still raging, and we are in the midst of a chronic stressor. So chronic stress occurs when stressors don't let up. Our bodies are built to manage brief, intense events. They do not respond as well, though, to prolonged high exposure to stress and trauma. Chronic stress can damage both your mental and physical health. Being chronically stressed may leave you feeling tired, may destroy your ability to concentrate, give you headaches, digestive problems. And acute stress, and that short-term stress may even improve certain immune responses. However, the wear and tear of chronic stress is really bad for your immune system at a time when our immune systems are really important to us. So chronic stress has been found to affect cardiac health, with multiple studies finding a link between stress and the development of coronary artery disease. So how do we keep our anxiety at bay, minimize the negative impact of a shared chronic stressor, and keep our loved ones reassured? Today, I will share with you a few ways to manage stress in these trying times. We will discuss ways to engage in problem solving and behaviors that improve our ability to regulate our emotions. So these healthy behaviors target our bodies, our physical space, our social circle, and our thoughts and mind. We'll also discuss a few tips on how to approach behavior change and when to seek professional help if stress has become too overwhelming. We'll also consider approaches specific to parents, kids, and caregivers. And for those seeking additional help or information, I'll try to provide some resources and to leave some time at the end for questions. So the first step, of course, is to identify the signs of stress. Have you noticed any changes in your mood? Are you feeling more irritable, sad, or anxious than usual? Our emotions give us valuable information, even the negative emotions like sadness and anxiety. When our emotions are functioning at their best, they're actually cueing us to the fact that something is wrong. And hopefully they would motivate us to ameliorate the situation. So if that's the case, that we're feeling this upset because something is wrong, we don't just want to stuff or stifle or manage the emotion when the real source of stress is that there is an issue or problem in our life that we have not yet addressed. For example, if we are feeling worried and anxious because we have not yet developed a childcare plan for our son's upcoming school break, we don't just want to distract ourselves from that worry with a deep tissue massage, even if it's at our favorite spa. Our time would probably be better served by addressing the issues we may be avoiding. So since our emotions are messages that we need to listen to, they exist for a reason. However negative or painful they may be, they are useful tools for understanding what is happening to us. And so we want to learn from them and then take appropriate action. So once we identify the source of our stress, we can then determine whether the best approach is problem solving because the issue is within our control, or emotion management because the issue is outside of our control, or oftentimes a mixture of the two. So to make this distinction, it's important to identify what you can and cannot change. Remembering we can only change ourselves, we cannot change another person. And when you try to change things over which you have no control, you will only increase your sense of frustration. And so once you've identified the source of the stress, it's time to ask yourself, is there some aspect of this I have control over? Is there something I can change? Because even a small change could make a big difference. I'm sure many of you are familiar with the serenity prayer. God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. So if the answer is no, you cannot change any aspect of whatever the source of your stress is. Avoid dwelling on the things you can't control. So when uncertainty comes up, a lot of us immediately imagine worst case scenarios. So we want to work to get out of the habit of ruminating on negative events. And in order to do that, some of the emotion regulation skills I talk about later will be really helpful. However, if the answer is yes, and that at least some aspects of this stressor we do have control over, we want to take action. And taking some action to reduce the stress actually gives us back a sense of control. So this is likely a problem that even once you work it out, cannot be fixed by tomorrow. However, you can probably write out or think through a plan of action by tomorrow. And there is a certain amount of peace that comes from this. Peace from knowing that you are no longer avoiding whatever that stressor is, that you are facing it head on, and that you are actively working to address the situation, even if that actively working is a long-term solution that will take time. So the goal is to strike a balance between actively working towards positive change and then radically accepting your world as it currently is as you work through change. Now, for those stressors of which we have no control, or maybe we've already engaged in the solution planning progress and we are working to strike that balance between acceptance of your current state and change, we want to engage in behaviors that help to regulate our emotions and mood. These are the activities that put us at our best, that help us to run on all cylinders so that we can ride the wave that's underneath us. Many of these behaviors focus on our physical body. And these are a number of things that I will mention here are ones that if you asked yourself, what would I need to do in a day or through a week to feel my best? These are probably the things that would come to mind. Sleep, food, water, alcohol use, exercise, and medical attention. So sleep problems can range from trouble falling asleep or staying asleep or waking up too early, or your quality of sleep being poor, and maybe your sleep cycles being disrupted or having vivid dreams or nightmares. And it makes perfect sense that sleep complaints have been on the rise right now because of all the stay-at-home conditions we experience through the day are a number of the factors that we know can negatively impact our sleep. So people are working, exercising, and socializing inside of their homes and even in their bedrooms, which can weaken kind of our mind's association between the bedroom and rest and relaxation. We're also facing more stressful situations. So limited social contact and support, a disruption of our routines. And those are things we already know trigger sleep problems. To the point where many Americans have actually turned to over-the-counter sleep aids like melatonin. The sales of melatonin in 2020 rose 42%, according to studies done by the Nielsen Market Research team. So the best defense against insomnia is to improve your sleep habits or your sleep hygiene. And good sleep hygiene practices start with establishing a regular sleep and wake cycle. So that's going to bed around the same time each night, waking up around the same time each day, and establishing a daytime routine that includes exercise, regular meals, exposure to sunlight to help to regulate your body's circadian rhythm, your body's natural desire to be awake when there is light and asleep when it is dark. It's also important to avoid caffeine within 10 hours of bedtime and alcohol within 3 hours of bedtime. A lot of us have the assumption that alcohol makes us go to sleep more easily. And while alcohol is a depressant, so it does make us feel sleepy in the moment, we usually then will fall asleep. But once the alcohol starts to work out of our system at night, it can actually disrupt our sleep, thereby decreasing the quality of our sleep. So when you wake up, you may find yourself feeling less rested, even though technically you were in the bed for the same amount of time and maybe even fell asleep more quickly, but your sleep quality was diminished due to the alcohol use. So what we recommend is the strict sleep and wake times, avoiding taking naps if you can, reserving all of your sleep for nighttime, and avoiding caffeine, alcohol, and large meals, as well as TV, phones, tablets, and screens, and exercise just before bed. And so the light that emits from our televisions, our phones, and our tablets actually tricks our brain into thinking that it's daylight and that it's actually time to be awake. And so it makes it a lot more difficult to fall asleep when we have screens in front of us because of that light that's coming directly to our eyes. And so we also want to think about the food and the fuel that we're putting into our body and that we're engaging in nutritious eating. So if food is fuel for our bodies in times of high stress, it's even more important that we focus on using high quality fuel. Also, our water intake. So the recommended daily water intake varies depending on a number of factors like your weight, climate, whether you're pregnant or breastfeeding, but basically determine your personal goal for the amount of water you want to drink, or just determine how much water you're currently drinking right now. And you would probably sit back and say it's probably not enough. So once you have logged and determined how much water you normally drink in a day, say, I want to increase that by 8 ounces this month. Month after that, or week after that may say, I want to increase it by another 8 ounces. So basically determine a goal, log your intake, and then make small steps to increase your water intake again, so that we are fueling our bodies and giving our mind and bodies what it needs in order to manage this period of potential chronic stress. So back to alcohol again. So the goal is to limit your alcohol intake. So many of us have been using alcohol or maybe even other substances to temporarily relieve boredom or stress, but it's needed to be mindful of the slippery slope with this, and obviously avoid alcohol if you've had problems in the past. And so if you are drinking too much, there are some options about what you can do with your drinking. So you could set a clear goal of stopping drinking whatsoever, reducing overall how much you drink, reducing your frequency of use, reducing how much you use in any one setting, or like I said, quitting drinking altogether. And so again, if that is a goal of yours, it's important just to initially log how often are you consuming alcohol? How many servings of alcohol are you consuming in a setting? Then sitting back to yourself and saying, is this what I think is best for me? Is this what I think is healthy for me? And if so, then setting if what you want is a gradual decrease, setting small goals to decrease either the frequency or the quantity of the alcohol you're consuming. And some of the behavioral strategies that can be helpful with that are removing alcohol from your home. If you are going to engage in some alcohol use, alternating between an alcoholic drink and a non-alcoholic drink when you are imbibing. And also thinking of some of the reasons why you may be drinking or why you may be using alcohol, and seeing if there are other ways that you can reach that goal, or if there are certain situations that you feel like you're more likely to overserve yourself, trying to avoid those situations. The other way to help to regulate our emotions through behaviors associated with our body is through exercise. And so physical exercise is extremely important for our mental health. It can help relieve mental health symptoms you already have and also prevent them from coming on. So physical activity, regular, moderate physical exercise is extremely beneficial up and down throughout your mind and your body. And so, and it's a stress reliever for people of all ages. The Centers for Disease Control recommend about 30 minutes a day of moderate intensity activity for 5 days a week. And then the last part in this section is about medical visits. So nearly half of Americans in that APA study I mentioned earlier said they delayed or canceled healthcare services since the pandemic started. And so it is, especially if you are vaccinated, it is time now to get back to our medical visits because this will also help us to work at our best. The other piece that's extremely important when it comes to managing the stress of this pandemic is making sure that we are doing everything that we can to prevent ourselves from becoming physically ill. And at that point, at this time, that is vaccination. So getting vaccinated against COVID. Being vaccinated against COVID is something that will greatly decrease the likelihood of you catching COVID, of you passing it along to others, of you being hospitalized, and of you dying of COVID. Now, risk is not a dichotomous variable. It's not on and off. So it does not mean that if you are vaccinated, you have no risk. That's not the case in any situation. Wearing a seatbelt doesn't remove all risk of you being injured in a crash. What it does is it decreases the likelihood that that would happen. And so as we're moving about the world, we want to be thinking about the ways that we are decreasing our risk. And with the huge global pandemic that we have before us, the best thing that we can do for ourselves, the most impactful self-care that we can do right now is to be vaccinated against COVID-19.
Dr. Woods, that is a great point about vaccination. I do know we have questions that's in the chat. We really appreciate the conversation. We have a lot of great comments that are coming in through Facebook and in Zoom. One of the questions in relation to vaccinations, many people are struggling to balance their safety and the safety of their families with the relaxed and COVID restrictions and comfort that being vaccinated somewhat provides. What advice do you give to your clients who are dealing with these feelings? The advice, so I try honestly not to
give advice, in part because I see my clients as being the expert on their life and their experiences, and me being ideally the expert on psychology. So what I try to ask people is what their goal is. So if you're trying to determine whether you should go right or left, you need to know where you're going. So if you can tell me what your goal is, so if your goal is to protect yourself from COVID, well, then there are some clear steps that you would need to take in order to do that. If your goal, on the other hand, is to deny your own needs for your family, like, you just have to figure out what your goal is. And then I would help them brainstorm what are the steps that would take you closer to that goal or further away.
That is extremely helpful. I think we have time for maybe one more question. But I do want to ask this. With the pandemic and advances in telehealth, record numbers of people are starting therapy now. What advice do you have when looking for a therapist? And how should people approach that to make sure they are getting the most out of therapy?
Excellent question. So one, we definitely offer therapy services at the Wellness Plan Medical Center. So you can definitely reach out to us and go onto our website. The other option that I recommend is a website or websites like Psychology Today. So Psychology Today is like a LinkedIn for therapists. So basically, therapists develop profiles. They write a description of their approach to therapy. You get to see a picture of them. You can search based on your zip code, what insurance you have, the therapist specialty. So therapy is a lot about fit. It's about finding someone that you're able to connect with. So I think it can be helpful to get even that amount of information beforehand so you can narrow down your options of who you want to approach for therapy. So there is also, like, I think goodtherapy.org is another site like that. I know Psychology Today because when I used to be in private practice, I had a profile there myself. So I don't any longer, but I would recommend people either check us out at the Wellness Plan or look into psychologytoday.com.
Dr. Woods, thank you so much for sharing this information. And I know that our viewers can learn more about you or get in contact with you via the Wellness Plan. So again, thank you so much for sharing that information. You know, it is interesting times as we're trying to transition back to a normal that we once knew. But again, it takes some time to undergo that transition. So thank you for providing these tips for us. Right now, I am going to turn it over to Eric Davis for our closing. And again, Dr. Woods, thank you so much for joining us today. Eric?
Thanks, Courtney. And thank you again, Dr. Woods, for taking time out of your busy day and sharing such important information with us all.
Happy to do it.
Yes, thank you. So we have a few more updates to share quickly before we close out today. As a reminder for anyone in our community who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. We maintain a running list of available services in the community and can connect you to the support you need. You can also look up resources in your area by using our 211 resource database at unitedwayscm.org/211. Next week at our What's the Word Town Hall, Wednesday Town Hall, we'll be joined by Kelly Dobner, Chief Advancement Officer at Samaritas, to hear about the organization's work to support Afghan refugees and how you can get involved in that effort. To see our previous town halls and to sign up for email updates on upcoming town halls, please visit unitedwayscm.org/virtual town halls. The website is also included in the chat box. Thanks again, everyone. Thank you for joining us today. We'll see you soon. Please, please, please stay safe and continue to live united.